I see a lot of people in their young ages in my office. Most people think that we see old people, but 40-year-olds come to my office often because for a variety of reasons they don't feel good. And I see and I've learned that many of us can do a lot of things at age 40 that can help prevent heart attacks and such. And those are things that we can prevent. And one of the things we can do is exercise. Often we are busy with work, with young children, so we neglect our health and we're running to and from places, but we neglect to exercise, which is a tremendous and most significant thing you can do to your health. It does a variety of things, many of which are things like lowering your blood pressure and your cholesterol, and the benefit it has is just immeasurable. The second thing that we can do is we go see a family physician and get our cholesterol level checked. Some people say that, look, I'm thin, it's not a problem, but it's really not an issue of weight or even perhaps a diet. We could be just genetically high and we could have very elevated cholesterol levels and not know it. And it would be like running your car with no oil in it and not checking your oil level. We should check it, and if it needs therapy, there are great drugs today that can lower it to great levels, and it would greatly reduce your risk of a heart attack. Third thing that we can do is go get a blood pressure machine. A lot of people come into my office and they say, I don't have high blood pressure, or I have white coat syndrome high blood pressure, but I see it all the time. And statistically, by the time you hit 40, the odds are high that you probably have high blood pressure, particularly if you gain some weight, going to your kids' soccer games and eating hot dogs and such, but you need to monitor your blood pressure. It's one thing that we can treat that can greatly reduce your risk of heart trouble. Finally, our diet. Most of us eat as best we can, but when you're 40 and working 8 to 12-hour days with young children at home, you're eating like your 9-year-old with macaroni and cheese. A general rule about good diet is if you avoid processed foods, meaning if you go to the produce section and eat foods that are not processed, meaning fruits and vegetables, and avoid the processed foods and a lot of carbohydrates. What we're understanding now is that if you can stick with the proteins and fruits and vegetables, you're doing generally pretty well. And those patients of mine who figure this out at age 40 or so, and they're in their 80s and looking healthier, and actually they are my healthiest patients who follow these basic rules of health.